Okay, this takes us to our very last video for chapter 13, and we're going to talk about nosocomial infections. And these are diseases that you get when you're in the hospital from surgical procedures or equipment or personnel or exposure to some drug-resistant microorganisms. Usually it's a surgical incision, or you're going to get it through your respiratory tract or your skin or your blood. You can get the gram-negative intestinal flora like E. coli, Klebsiella, the gram-positive bacteria, Staphylococcus, Streptococcus, also yeast, and then you can get things like tubercle bacillus, tuberculosis, salmonella, hepatitis B, and of course influenza. You have 2 to 4 cases per year in the United States, usually causing around 90,000 deaths. And these are your nosocomial infections. You can see here, leading the way would be through the respiratory tract or surgical incisions, GI tract at 17%, urinary tract at 13%, and of course blood at just 10%. How do they prevent it? These are the protective things they'll do. Wearing the gowns and gloves, giving you private room with closed doors, sometimes a mask. They'll make sure that everybody that comes in washes their hands, and strict isolation sometimes, and even the HEPA filters to remove the airborne pathogens are sometimes used. Now, universal precautions were measures that the CDC has developed to prevent the spread of these nosocomial infections from patient to patient, from patient to worker, and from worker to patient. And it's based on the assumption that all patient specimens can harbor infectious agents. So we're going to treat them all with the same degree of care. And we're going, if we can't totally prevent them, we're going to use techniques to keep us from purposefully transmitting them and try to decontaminate anything that's infectious or could be infectious. The occurrence of an infection indigenous to animals but naturally transmissible to humans is a zoonotic disease.